Out you come, sweetie. Out this way. Oh, look how big you are.
Queen Bee, the massive 2-year-old Burmese python, is suffering from an inflamed, swollen mouth.
Yeah, she's got a bit of an erosive lesion on that bottom right-hand corner, so a bit of a mouth ulcer, if you like.
Yep.
It's eating down into her gum line. The way it is right now, and left untreated, she won't eat, and that'll be the end of her. And she can bite, can't she? I mean, she's got teeth.
While you're poking around her mouth, she's got her 2 teeth are about 4 mils long.
Yeah, that's nice. It's reassuring.
Thick as a needle.
Burmese pythons aren't venomous, but can easily kill a human by constricting their victim and causing blood vessels to explode.
That doesn't help. She's smart.
She's having you for lunch.
I've still got one arm. That was quite a standoff when Queen Bee wrapped herself around me. Each time I touch her, she goes harder on me too.
Chris looks more like a cat handler, I guess. I could see when it grabbed him around the arm there, it kind of went a little bit white like a ghost, and it was quite funny actually to see, but I think he held himself pretty well.
Okay, we'll give it a go.
The 4-metre python needs a broad-spectrum antibiotic to eliminate her mouth infection.
It moves away so quickly.
Chris is struggling. His first 2 attempts failed.
She just has this reflex movement. There we go.
In?
Yep. She ain't happy.
Oh, in.
All right, so that antibiotic will sink in through a system and go from this end all the way up that end and treat that infected mouth.
Hopefully her mouth will start to deflame. We'll be able to get those beautiful bunny rabbits back into her.
You're gonna be all right. Baby, please, just relax.
Wendy has rushed into the Bondi Referral Hospital sash with her critically ill cat.
Okay, what's happening?
His blood's like a grey-black and he's lost all his
Okay,
colour.
I'm going to take him straight out the back and give him oxygen. You just stay out here and... I'm going to take him out and I'll come and talk to you when he's stable. I'm just going to mask this cat. He looks like crap. Serena, can you just get an oxygen mask? Okay, this cat is blue. He's really not getting much oxygen around his body.
Emergency vet Lisa Chimes is almost certain the cat has swallowed human medication.
I think he's had paracetamol toxicity. His gums, his lips are all swollen. Paracetamol causes damage to the red blood cells so that they can't carry oxygen around the body. And when you can't carry oxygen around the body, you can't get oxygen to the brain and you die.
In a cruel irony, the cat's name is Lucky. There is an antidote for paracetamol poisoning, but its effectiveness depends on how long the toxin has been in Lucky's system.
Paracetamol can kill a cat within 4 hours, so we really have to act quickly. Yeah, baby, it's okay.
At the Australian Reptile Park, marsupial keeper Tim Faulkner has another difficult case for Chris.
All right, put her in there.
A 4-year-old Tasmanian devil with a seriously infected teat.
So we know when she had Joey's last year that it obviously wasn't like that.
Yeah, exactly.
And it did go down when the Joeys were weaned.
Yeah.
It did go down, and it come back up after that. Sorry, Black.
That teat itself is really ballooning out dramatically. Now, it's almost 10 times its normal size. It's red, it's inflamed, it's enlarged. Alarm bells are ringing.
The situation is even more critical because of Blackie's special status. A vicious disease called devil facial tumour has wiped out more than half the devils in Tasmania. Blackie was shipped to the mainland to ensure the species' survival.
Come on, Black. You're all right.
There, come on, girl. This species is on the brink of extinction, and without good breeders like Blackie around, that's the way it's heading. The problem is that that's not going to be functional.
Yeah, that's right. No Joey can attach to it.
Sadly, Blackie is now facing an altogether different life-threatening disease.
There's a lot of things it could be. The one I'm really worried about though is cancer. It's very enlarged, it's very ugly, it's very inflamed, very red. That's how cancer looks.
Stop it.
Next on Bondi Vet, Lisa's race against time to save Lucky the poisoned cat. And the hazards of helping an angry devil.
Just watch it, because she will swing right around.
Okay, I'm fast, mate. I'm fast.
Yeah, she is too.
Okay, stop it.
At Sash, Lisa's under huge pressure to stabilise Lucky, but the terrified cat is fighting her health.
It's all right, sweetie, calm down.
Lucky has paracetamol poisoning and is just hanging on.
No.
Come on. It's all right.
Hey kitty. We can't give you an antidote if you keep moving. Come on. Okay, just get that oxygen mask on. We're stabilising him at the moment and he looks pretty bad, but I have seen cats that are this bad get better, so we're doing our best to pull him through this.
Lisa needs to ask the owner, Wendy, for permission to give Lucky the antidote.
We're not going to see the results straight away.
How long does it take?
I mean, he could take several days to get better, and I can't guarantee you that he's going to recover from this. But he still might not get better. Okay, we're going to give him his best shot and do absolutely everything we can, but I can't promise you anything. Okay.
Lucky's been with us since he was 2 or 3 weeks old. He's like our own little baby, really. You know, we syringe fed him. Got the photo. He's just like one of the family. Our little baby. I had no idea that paracetamol could do that sort of thing, you know, but I know he certainly didn't get it from us.
Okay, keep it still because you might jump here. We're looking to see what comes out of that syringe. If it's very firm and if we get cells or tissue out of there, that's bad because that implies that it's cancerous. If we get fluid, however, that's good news. It could be a cyst. It's very diagnostic and pretty simple and very quick. We'll have an answer very quickly.
At the Australian Reptile Park, Chris is about to discover what's wrong with Blackie the Tasmanian devil.
Pass.
Fluid.
Good?
Yeah, it looks like a cyst.
Good news.
See how that's collapsed right down?
Yep. Quite a bit in there.
There is, and there's probably more to come too.
Oh, great. Relieved. I mean, cancer is a big word, you know, and I had a lump in my throat for a minute there, but when I seen that fluid come out, and from what Chris had said, I was really happy, really happy.
This is what's actually in there. See how it's really watery?
Yeah.
The infection has been caused by a blocked milk gland.
Very awkward to hold it.
Yeah.
Chris is now attempting to draw out more fluid, but Blackie is becoming very distressed.
We're not going to have much longer in here. I'm getting harder and harder to hold her.
All right, we're almost done. You can see that when I squeeze that.
Come on, Black. You're all right.
There, come on, girl. The concern is, though, that when you've got fluid in a spot like that, it can very easily get infected.
Yep.
And it could go from being a cyst to being basically an abscess.
The solution's easy, antibiotics. The hard part is giving a needle to a highly agitated devil.
Now, just to reduce the risk of...
Just watch it, because she will swing right around.
Okay, I'm fast, mate. I'm fast.
Yeah, she is too. The front's got canines and the back is scissor-like shearers, so, you know, they'll take a finger in half. Just be ready for her to swing, because she's pretty fired up. And they don't look like she's going to turn around, but she will very, very quickly.
Okay. Ready? Done.
Easy. She can go away?
Yeah, she can go.
Okay.
She can go.
Nearly over.
Anyway, in she dives. The chances of her breeding again are dependent on how well that teat's going to function. But if we can keep that healthy, keep it clean, then she could be mum again. And for the species, that'd be fantastic news.
happening?
Just really shallow breathing. And it did stop for a little bit.
At Sash, Lisa is about to give Lucky an antidote for his lethal dose of paracetamol poisoning.
Okay, can we get the crash cart? Lucky's just crashed and it's happened before we've even had a chance to give him the antidote. Is there a laryngoscope anywhere? Yeah, he's just arrested.
The toxin has shut down Lucky's system. His heart has stopped beating and he can no longer breathe on his own.
We're giving the antidote while we're doing CPR. His chances aren't very good, but we've got to give everything we've got to get him home to Wendy. Sophia, do you want to stop for 1 second so I can see if we've got a... Oh, there's some P waves. Okay. What are my chances?
Coming up on Bondi Vet, Chris tackles a tricky rescue mission.
There's obviously predators around. We need to relocate them to a safer place.
And can Lisa bring Lucky back from the brink?
Be lucky, okay?
In the heart of Bondi Junction, 7 Staffordshire Terrier pups are causing havoc at their home in a fancy dress store.
Oh, you rat.
Renegade will be the first to leave home.
It is sad. I'm still trying to fight the fact that I'm going to maybe keep the other 6. I think I'll be sad if any of them leave Bondi.
But before Renegade can go to his new home, Nerida's taking the whole family to the Bondi Clinic for their vaccinations.
And they're still asleep.
Chris has just returned from the Reptile Park and is back in his comfort zone.
Mona doesn't do a lot, does she?
The team includes Mona,
3.64 kilos.
Spanky,
Do you want to tell me how you got the name Spanky?
Buckwheat,
6.
Alfalfa,
7. It's 8.
and Miss Lilu.
At 6 weeks of age, they're just so fragile. Their immune systems are really underdeveloped. So the fact is, vaccinations are a must, and they've got to be on time. Sure, give them all the love and attention you want, but just don't forget their shots. Thanks.
How's that for a reaction?
So I'm pleased to say the entire gang is fit and healthy, but I've got one concern. Nerida. She's going to go through some serious heartbreak when she has to say goodbye to these puppies. Got a beautiful family in Nerida. Come on, guys.
Very heavy. So I have my own personal puppy carrier now.
Come on, kitty. Hey, come on, Lucky. He's called Lucky. Oh, never call a cat Lucky. Never call a cat Lucky. But be lucky, okay?
Lisa is administering more atropine and adrenaline in a last desperate attempt to save Lucky.
Oh. Okay, come on. She loves him so much. Unfortunately, Lucky hasn't made it, and we did absolutely everything we could to try and get him through this, and the toxin had just taken effect, and it's too late.
Wendy is convinced someone deliberately gave Lucky the paracetamol.
You're pretty angry now.
You know, I'm very angry that people are that wicked out there that they can kill little animals. They're so helpless, you know. And he was so loving. It's like losing one of your children, you know. It's just heartbreaking.
It is extremely important that people realise how toxic paracetamol is to animals, especially cats. And we've just seen Lucky lose his life because of paracetamol, and people just need to be aware of how deadly it is.
What you got here?
There's some ducklings in there.
Hey, Mum.
Chris has received an urgent call from Barry, a member of the wildlife rescue group Wires.
Probably not the place to raise kids on a building site, is it?
No.
We've been called out to a house that's under construction because the neighbours have seen there's a family of ducklings trying to eke out a living in the family swimming pool. Only problem is there were 4 yesterday, there's now 3. We'll just approach slowly here. The house isn't a place for these ducklings to be raised. There's obviously predators around. We need to get the ducklings, catch them all, try to get the mother as well, and then relocate them to a safer place. We want to keep the family unit together, so we need to approach this very carefully with a very distinct plan. Could be getting dirty here, Barry. Could be getting very dirty and very wet.
The pool is putrid, full of plastic bags that could easily drown the ducklings if they got trapped.
We lost one last night by the sounds of it. We don't want to lose another one. Plus there's a big storm approaching. We have to act and really act now. In your world now, aren't I, ducks? I've got to say I'm a little bit nervous because this is a tricky place to work. We're dealing with wild animals, animals that are going to be scared of us. Keeping them all together is going to be really, really difficult. One hell of a challenge.
The mother is now secure in the holding cage. That's supposed to be the trickiest part over. But the ducklings are showing no signs of coming quietly.
Come to Uncle Chris. Good friend of your mother's. Come on. You're getting fast.
Next on Bondi Vet, Nerida prepares to say goodbye to the first of her new puppies.
Totally sucks.
And Chris is outmanoeuvred by a submarine duck.
How do you do that? Maybe if I heard from this way, Barry, and you catch at that end?
At the construction site in Bondi, Chris's frustrating rescue mission continues.
It's all sorts of junk under here. I don't even want to know what it is.
One duckling has already died, and Chris is trying to rescue and relocate the rest of the family.
We've been really successful in grabbing 2 of the 3 ducklings, but there's one still in there that thinks it's a Red October. It's the submarine duck. How do you do that? Where? Oh. Every time you go near it, just goes under and away. Okay, where are you going to come up? And you have no idea, you can't see anything underneath there. Very smart duck. That was a good move. Even though this is a very good tactic from the duckling, the worry is that if you get stuck underneath one of these plastic bags, it's going to suffocate. Oh, I don't even want to know what that is.
Chris has decided to use a new tactic to get hold of the last elusive duckling.
He was just sitting with his nose under the water like he was hiding. Because we just want to keep him out of the water because he's very good in the water. Little Thorpey. I think I've got you. Little submarine duck. You see the family? Feeling really relieved. That could have gone really pear-shaped very quickly. If Mum had decided to take off down the central runway here, out, that could have been the end of the family, but we managed to get her quickly, and with a bit of extra hassle, grab the babies as well. So, great result. Now, take them to a good spot, release them. Hopefully the family has many more happy years ahead.
Meanwhile, at Bondi Junction, Nerida is preparing herself to say goodbye to the first of her 7 pups.
I believe this belongs to you.
Oh, thank you so much.
Officially belongs to you.
One less mouth to feed.
One less, yeah.
One more for me.
Renegade's new owner, Dave, is a builder in the local area.
He gets to come to work every day with us, hang out at the beach, do everything, you know, a dog should do. It's going to be all good. I'm going to see Mama as well. See ya.
It is hard with all of them, and it's going to be harder because she's here every day with us as well. So, but that's all right. They're all going to good homes, and I still have 6 more. It totally sucks.
Gonna refer it to the manager, are you? Are you the manager? Talk to you about accommodation? Hey, guys, kids are around, all right? No fighting. We'll just be up here.
Chris and Barry are relocating the mother and her 3 ducklings to a much safer home at Centennial Park.
Do you ever get the feeling you're being followed, Barry? Seem to have upset the local order.
After the stagnant water in the pool at their last address, This is paradise.
I'm guessing because you're the feisty one, you're the submarine duck. They're going to be relying on you. Look out for your brothers and sisters, all right? Okay. You go out there now and you enjoy yourself, okay? Stay safe. That's great. Good result, mate.
Good one.
Good on you. I just can't believe these tyre marks here.
A loyal Labrador in trouble after a head-on collision with a car.
If that hit's been big enough to sever a blood vessel, then that could be life-threatening over the next hour or so.
Lisa battles a mystery illness attacking a helpless kitten.
It's a fatal disease and it's just not something that I want to go and tell his owners.
And Chris heads home to the bush, but gets called out to help with a difficult birth.
She's not making much progress at the moment.
Make my world a better place. I can't depend on you. I can't depend on you.
Come straight through. Jeez, look at that.
His eyelid split open, you can see. Yep. He saw my son, got very excited, and just bolted down the stairs and across the street.
Cody, a young Labrador, has just been run over by a car.
He's copped a fair knock 'cause he's got a bit of hemorrhage around the eyes there. His gums are fairly pink there. I wouldn't say they're a rich pink, but they're pink enough for me right now. Heart rate's obviously very high, just because of the stress, but lung sounds are okay, and you can see that general respiratory rate isn't too bad. He is panting, that's a result of the shock. Yeah, I just can't believe these tyre marks here. That's all rubber along there and then down here, so geez, it doesn't look as though the wheel's gone over him, but it's certainly given him a pretty big bump. His oxygenation's at 94%, 95%. It's a little bit low, it should be above 96.
Low oxygen levels can be a sign of internal bleeding. If it isn't stopped immediately, it can quickly kill.
Cody has been hit quite hard by that car. If that hit's been big enough to sever a blood vessel in the abdomen, then that could be life-threatening over the next hour or so.
It's all right.
Felix.
Meanwhile, at Bondi's referral hospital SASH, a 5-month-old Burmese kitten has just been admitted with a mystery illness.
Well, Felix was absolutely fine until yesterday, and this morning he didn't eat his breakfast, and he was really down, and he's usually a lively little kitten, and his skin was all dry, and then he started retching and vomiting and diarrhoea and just being really floppy.
He's reacting when I'm touching his kidneys. Felix is in a lot of pain. Cats are normally really stoic animals, and he's yelping out when I'm feeling his abdomen, so he's in a lot of pain over there.
Have you eaten something not nice?
It's possible that he could have swallowed something. He's a young cat, and kittens play with things, so...
Indoor, outdoor.
Yeah, they ingest lots of different things, and it's very possible. I can't feel anything obvious there, so he's a very sick little kitten. Yeah.
Felix is your friend, isn't he? You're a bit sad as well.
Let's just hope it's something that we can fix.
Listen, they've got him on the table. They're giving him a bit of oxygen.
Cody, the Labrador, has been hit by a car. Chris is worried about internal bleeding.
Basically, my concerns are the fact that our oxygenation level is low. His breathing certainly isn't great. He's panting a little bit, so we just need to stabilise that with some oxygen and just try and calm him down with some medication as well.
Brendan started crying. Oh, that's sweet. That's my son. He had a meltdown.
Natan's 9-year-old son Brendan was there when Cody was hit, and he's rung up for a progress report on his canine friend.
Who's that? Brendan? Talk.
Hello, boy. Are you alright? If you're alright, I have a treat for you at home.
No, he'll be okay, Brendan. Okay, so don't worry about him. He's in good hands.
Hi, Daddy.
All right, Lara, you're on speakerphone and Cody can hear you.
Little sister Lara is next on the phone to check on the patient.
Yes, he's
She
panting.
seems more worried about the vet's condition than Cody's.
That's right.
Is he fat or not?
No, he's not fat. That's my daughter. She's got all these very pertinent questions. What if I was fat?
I don't know.
Should probably say you got the biggest loser, like Daddy. Bye. If anything changes, I'll call. I promise you, I'm looking after him. I'm very worried. Oh, my son is. I'll put it a little emotional.
It's quite a nice, healthy reminder about the fact that, you know, you're not just treating the patient here, you're also managing the emotions of everyone that's waiting at home and you know, expecting good news here. So hopefully we can actually give it.
Let's get some blood off him to try and give us an idea of what's going on.
5-month-old Felix has been rushed into SASH with severe abdominal pain and a high fever. Lisa is running tests to work out why.
He's a pretty sick little kitten. He's got a temperature of 41.3, which is quite high. He's definitely got abdominal pain, like you mentioned before. He's groaning when I'm pressing. I wonder if it's his kidneys that are sore. It's really hard to say because there's so many organs in there. We need to try and work out what's going on because to have that amount of pain, there's got to be something nasty going on in there.
Good boy, good boy.
With the signs that Felix is showing, I guess I'm concerned about an infection of the kidneys, pancreatitis and another disease which is called FIP, feline infectious peritonitis. Oh no, you're not going to put up with us for much longer. If he's got FIP, it's really bad news. It's a fatal disease and there's nothing we can do for them. And it's just not something that I want to go and tell his owners. You want to give your mum and dad a cuddle? Felix is a much-loved little kitten. He's their baby and they're really worried about him. Hopefully I'll have some more answers for them by the end of the day.
I'll call you later, yeah?
Coming up, Chris leaves Bondi for the bush.
I reckon we should probably actually go and see if he's all right.
And will there be complications for crash survivor Cody?
The tail just keeps on wagging there, doesn't it?
It's a happy
Typical
boy.
Labrador.
Happy boy.
You've been hit by a car, okay? Try and act like it.
Cody is one lucky dog.
The oxygen level's coming up really nicely.
It's great news for Natan. Cody's oxygen levels are climbing and the threat of internal bleeding is now over.
Cody has been hit by a car. The whole right side of his body is covered in tyre rubber. Yet his tail's wagging and I'm okay for him to go home.
You're a very good boy.
It just adds a little bit of weight to this theory I've got about Labradors. Nothing worries them. They're great dogs for that reason, but they wouldn't be winning any IQ test competitions.
Clearly, Cody's starting to feel better and more relaxed.
You gotta love your job sometimes.
It's all right.
That's all right, it's part of the job.
A few stitches for that cut eye, and the lucky patient can go home.
What an amazing recovery. Cody came in looking extremely stressed and he leaves with a smile on his face, all after being hit by a car. If all hit by car cases could go like that, then my job would be all smiles.
Over at SASH, Felix's blood results are in, and the news is not good.
He's got a white cell count of 35, the upper end of normal's 19.5, so that's a pretty significant elevation.
A high white cell count indicates inflammation of the organs. This means it could be FIP, a disease that attacks the entire abdominal area.
FIP is a fatal disease and there's nothing we can do for them, so I'm a little bit scared that that's what he's got and I'm hoping that's not the news I'll have to break to his owners.
Felix will need an ultrasound to clarify the diagnosis.
She just had a seizure.
But before that can start, there's an emergency in the treatment room.
I need someone to tube this.
All right.
She's stopped breathing.
Bianca, a 14-year-old Maltese Terrier has suffered heart failure. When a dog crashes like this, everyone is required to deal with the crisis.
There's not much talking, everyone works on autopilot and you know what you have to do, and it's got to be done quickly if you want to get the results.
Heartbeat's 120.
Fortunately, the vet stabilised Bianca within minutes. Now they can turn their attention to the ultrasound that will determine Felix's future.
You're all right. You're all right.
Chris is now heading to the bush for a special visit.
It's just so good to be back around here. I love this country. Not that you can really see much with all the fog around, but to be back here in a place where I spent a lot of time as a kid and also did a lot of my prac work during my vet course with Rusty, and to be asked to be the official vet at the Stroud show, it's a big honour, and we're looking forward to a very big day, aren't we, Russ? In terms of jobs, this is a pretty easy one so far. It's very different to the Easter show, but I like it because you've got two cows here competing against each other, so you're a fair chance of a ribbon here. In fact, you're guaranteed of a ribbon here.
Walked out nicely. A very worthy winner.
There you go. He's a beauty. Well done.
Hey, come on, Stroud, let's get ready for the umpire.
I think the bulls are doing just fine. Health-wise, they're great. It's the riders I'm actually worried about here.
Big Sam, the ball gets out. He nods for the game. He will get out. 5-8 has a ball maker. 110% effort.
I think we should probably actually go and see if he's all right.
You're right, Diamond. You're supposed to be win.
Hurt yourself?
Oh, a little bit.
Where'd you hurt yourself?
Just hit the paddles. Yeah. Just on the leg. Nothing serious.
Don't need a vet, do you?
Nah. It's only a bull.
You're an animal. You do need a vet after all.
Coming up, will Lisa's worst fears for Felix be confirmed?
Oh, I really hope it's not FIP.
And Chris rolls up his sleeves at the farm.
It's like trying to tie your shoelaces in the dark.
Chris is back at his old stomping ground in Stroud, northwest of Sydney. His mission today, to look after any animal emergencies at the local show.
Okay, I'll get there as soon as I can. Thanks, Juliet. Okay, bye.
But there's a sudden change to those plans.
I just had a call from a farm really close to here. Ironically, it's the dairy farm I did my prac work at. It's unbelievable. It's the Clarks. They're a lovely, lovely old couple, and they've got Guernseys and Friesians, and apparently one of them is having severe trouble getting a calf out. So getting there as soon as we can.
Righto, she can come in. Remembering to show you, I've seen one foot, not the other. There should be soap on top of the fence there.
The calf is stuck and the situation is becoming critical.
First of all, I feel for the legs, and one leg's bad, two legs is great.
Yeah, 1 foot. Got a head there as well.
Hot little belly.
At the Bondi Referral Hospital SASH, Lisa's about to find out the fate of young Felix.
In this ultrasound, we're looking for signs of inflammation, any free fluid, enlarged lymph nodes, abnormalities in any of the organs. We're also going to have a look at the pancreas and the kidneys to make sure that they're not inflamed.
Vet Darren Foster is hoping only one organ is affected, which would rule out FIP.
So the fact that you're seeing it like that is very significant.
Yeah, and that's where he's most painful as well.
Oh, I really hope it's not FIP. Worst case scenario for Felix would be that he has feline infectious peritonitis, which is a really nasty disease. It's a terminal disease and they can have days to months to survive.
The kidney and bladder are given the all clear. Now Darren checks the pancreas.
Just down here. He's got this black spot through here.
Yeah.
And all the fat around here is quite inflamed, and that black spot, I think, is his pancreas.
Oh, pancreas.
Yeah, so I think actually he might have pancreatitis.
Well, that would be best case
The
scenario.
best case scenario for little Felix.
The pancreas is a gland that produces enzymes which help digest food. When inflamed, it's very painful.
Probably from bacteria that get in up from their bowel and infect their pancreas, or just from sudden dietary changes, dietary indiscretions, eating mice.
Are you happy?
That's great.
Are you really happy?
Yeah.
Okay, good. If you're happy, I'm happy.
The treatment for pancreatitis is lots of fluids, antibiotics and pain relief.
All right, little Felix, I think this is your lucky day. Huh? Let's get you back in your cage. I know. Come on.
Just want to be able to feel both legs and make sure the calf's actually facing the right way.
On his visit to the country, Chris has taken a call to help this distressed mother-to-be.
You can see she is pushing, which is good. She's not making much progress at the moment.
Dairy farmer Juliet has been on the land all her life and has seen hundreds of calves born.
You get some stillbirths, particularly from big calves, but sometimes difficult positions.
How long's she been in labour for?
An hour.
The longer the labour, the greater the risk to both mother and calf.
How many calves has she had?
7 years old, so a few, yes.
She's getting some good contractions there. Okay, so you can see the feet are starting to appear here. Had a bit of water's breaking. Now, let's grab one of those ropes there. It's like trying to tie your shoelaces in the dark while someone tries to push you off your feet. It's difficult because everything's pushing in and moving your hands away from where they should be, and it's a challenge. Give it a bit of a pull. Here we go. And you can see it's a fairly big calf. Explains why she's having trouble with it. There we go.
Coming up, Felix fights back.
Felix.
And a tough time for Chris in the labour ward.
I'll go one more push.
Hey? Sick of being in a cage.
At SASH, Felix's treatment for acute pancreatitis is already working.
Felix. Felix is doing really well. His temperature's come down to almost normal, still slightly up, but he's definitely feeling a lot more comfortable in his belly. You're a monkey. What? You want to go home? You want to go home?
Oh, it's Felix.
Oh, it's your baby. Felix.
There you go.
Oh, it's just fantastic news. I can't believe he's so well after less than 24 hours. It's amazing. After yesterday, I thought it was pretty grim. I didn't think he was going to make it. Good boy, hey? He's worrying us sick. Lovely to have you back, hey, mate?
Yeah.
Oh. Who's going to give him a kiss?
Yeah,
Mariki, what about the kiss of the cat?
Kiss for the cat. Good boy. Hey.
Beautiful boy. Thank you.
Good push. Almost there.
Chris is trying to deliver a stuck calf.
So we've got the head out, got the front legs. Go on, Gil. See the shoulders, which is a very wide part. Sorry, Gil. There we go. Good work, good work. Just got to clean out the mouth. The calf's alive. It's important just to get in there and get all the mucus out of the mouth. Hello, welcome. Welcome to the world. We'll just get up there and give it. Try and drain some of the fluid out. We're nice and alive. It's almost good to, it sounds cruel, but even annoy them, just trying to get in their throat and get up their nostrils, just really stimulates them to breathe and open up their lungs. Hey, Look at you, all slicked up. Yeah, little heifer, little girl. This is an important bonding moment for the two of them, but she's trying to get the calf nice and dry so it doesn't get too cold. And just these little grunts she's giving them, just saying to the calf, look, I'm your mum, welcome. We've had 9 months together, but this is the first time we've actually seen each other. So, you know, it's a very special time for her. This little one's all a bit confused about what's going on, aren't you? You're beautiful. Ready to face the world, aren't you? But no matter how many times you do this, it's always pretty special.
Her name's Ivanhoe Zing. She's got a father's name and a mother's name.
Oh, nice. Already named too.
Oh, yeah.
You're efficient, aren't you?
After just a few minutes, it's back to the milking shed for Mum.
It's a tough moment, Mum leaving the calf after she's had her inside her for 9 months, and then, you know, it's over like that. But it's farm life, you know. It's very real.
Back at Bondi, Cody, the lucky Labrador that survived being hit by a car, is in remarkably good shape.
It was a really close call and we're just so lucky that it's all worked out for the best. He nearly got very seriously injured and we're just lucky that it's all better now, and we've certainly learnt that, you know, we'll keep him closely guarded to us next time.
And remember Brendan and Lara who chatted to their injured friend over the phone? Well, they all know the new rules for Koga.
I think we should always keep him on a tight leash unless there's no cars around or it's a park.
He can't get me any more dirty, so let's go. Oh, it's like a big black Labrador, only slightly different.
Chris has just helped deliver a beautiful female calf.
Juliet will never say it, but she'd be absolutely thrilled it's a girl. Males around here, unfortunately, they're just of no use whatsoever. It's the females that produce the milk. This is a dairy farm. They rely on the milk to make the money. So females are all the go. You don't get much milk out of a male. Come and meet your friends. You know what? They've been through exactly what you've been through. Oh, gonna use these?
After a warm welcome to the nursery, it's time for Ivanhoe Zing to try out her shaky legs.
You're good, you're good. It's that little right one. Hey, well done. You made it. You made it, girl.